Hmm?
Hello dear students, today I am going to explain about a topic that I have already discussed in the previous class, that was about asthma. In that class I have discussed about the intro of what is asthma and about the different drugs that generally used to treat asthma, and there are different types or different classifications of drugs. And also we have studied about what is asthma, what is the reason, and what are the types of asthma in the previous video. So before going to the today's video, you should go and check the previous video to understand the classification of anti-asthmatic drug. Today I am going to discuss about the individual classes of anti-asthma that I have already discussed about yesterday or last class. So now today we are going to discuss into the individual drugs. First classification what we have studied, that is bronchodilator. And that bronchodilator we have studied different type of example, that was salbutamol, terbutaline, etc. Today in this class, in this slide, I am going to explain you about the salbutamol and terbutaline as also the same type of mechanism of action like salbutamol has. So in this bronchial or bronchodilation, first subclassification what we have studied, that was our beta 2 sympathomimetic. From the name only you can understand this is the drug which generally act as beta 2 receptor and shows its action by binding with beta 2 adrenergic receptor. Now that beta 2 sympathetic drugs, how that are going to show bronchial dilation and going to treat asthma, that I will discuss now. That salbutamol that generally helps in treating asthma by dilating the bronchial muscle or bronchial smooth muscle. Now how it is done? It is done by stimulating beta 2 receptor. How it is going to promote? By binding with beta 2 receptor, and for that beta 2 receptor formation, that will leads to the formation from ATP2 or adenosine triphosphate to CAMP or cyclic adenosine monophosphate. Now when that cyclic adenosine monophosphate is forming more, then that amount of CAMP will increase slow by slow. When that CMP is increasing into the cell membrane, it will lead to the activation of myosin dependent myosin light chain kinase, or in short we can tell as, or we can name as MLCK. So due to the activation of myosin kinase or MLCK, it will lead to the binding of drug with the axons, and for that binding with axon, it will lead to the relaxation of bronchial smooth muscle, and due to the relaxation or dilation of bronchial smooth muscle, it is going to show its anti-asthmatic activity, and sometimes it also interferes into the formation of inflammatory mediators. How it is going to? It is going to decrease the formation of different inflammatory mediators like interleukins, prostaglandins, then cytokinins, then leukotrienes, etc. By the formation or less formation of all these inflammatory mediators, it will lead to the bronchodilation and it will treat asthma and so is anti-asthmatic reaction or antihistaminic property. Now we'll study about the dose, how much it should take daily. So what is the dose of salbutamol? The sol of salbutamol is, if it is in oral form, then it will be 2 to 4 mg per day as oral route. But if you are taking it as a injection or as a parenteral, then you should take 100 to 200 microgram per ml of injection. So when you are taking it as a oral form, it should be taken 2 to 4 mg per day, and for the case of injection, you have to take 100 to 200 microgram per ml of injection. Terbutaline is also the same. It is also going to show its action by binding with beta 2 receptor and act as beta sympathomimetic drugs, and going to treat bronchial asthma by inhibiting or by dilating bronchial smooth muscle. Now we will study about the second subclass of bronchodilator, that was methylxanthine. The next subclass of bronchodilating drug, that was methylxanthine. And what is the example of methylxanthine? That was theophylline. Now we will study how the theophylline is going to act as anti-bronchial or anti-asthmatic drug. How it is going to asthmatic drug? It is going to inhibit the bondage of phospholipase A2. Phospholipase A2 enzyme, and due to the inhibition of phospholipase enzyme, it is going to break down ACH, and due to the breakdown of ACH, it is going to form ATP or adenosine triphosphate to CAMP or cyclic adenosine monophosphate. Due to the formulation of CAMP, the level of CAMP is going to increase day by day, and due to the increasing of CAMP, it will lead to the bronchodilation. And sometimes this drug also shows its action by increasing the release of dependent inhibitory mediators, especially. So by decreasing or inhibiting the release of leukotrienes, it generally shows bronchodilation, and that by bronchodilation it is going to show its anti-asthmatic property to treat asthma. And how much drug you should take? You should take 50 mg per ml of drug per kg daily or per day. So that is the dose you have to take, and this is how methylxanthine is going to show its action by dilating bronchial muscle and going to treat asthma. Now we are going to explain about the mechanism of action of third subgroup of bronchodilator that going to act as anti-asthmatic drug. What is that? That is third type in that only, that is anticholinergic. By that name only you can understand that it is going to show its action by inhibiting the cholinergic receptor. How it is going to do that? It is going to do by binding and by blocking the cholinergic receptor. And how it is going to decrease the cholinergic receptor? By binding with M3 muscarinic receptor. When it is binding with the M3 muscarinic receptor, it is going to decrease the formation of prostaglandins, cytokines, etc. And it is also going to decrease the formulation or the release of acetylcholine. and due to the decreased release of acetylcholine is going to activate the GQ protein, and that activation of GQ protein will lead to the activation of phospholipase C, and due to that activation of phospholipase C, it is going to show calcium reflux, and due to the calcium reflux it will lead to the bronchoconstriction and going to increase the bronchial secretion. It is going to show bronchial secretion, and by showing bronchial secretion it is going to show its anti-asthmatic drug and will treat asthma or bronchial asthma. Now we have to study about the dose of anticholinergic drug. The dose of anticholinergic drug, it should be 100 microgram per dose metered, and you should take it as a inhaler form. That means by your nose you have to take it. So what is the dose? It 100 microgram per dose metered, because you have to take it through inhaler. And what is the example of anticholinergic drug that is going to show its action as a anti-asthmatic? Example is ipratropium bromide, and the dose I have already told you, 100 microgram per meter dose, because you have to take it by inhaler. So by that I have finished off the third subtype of bronchodilator that is going to show its action as a anti-asthmatic drug. So in today's class we have explained about the first sub classification of anti-asthmatic drugs that is very important for the exam, that is bronchodilator drugs that are going to show action as a antihistaminic. Example I have discussed already in previous class. Today's class I have explained about their mechanism of action, about all the sub classification where we have studied about beta 2 sympathomimetics, then xanthine drugs, then we have studied about anticholinergic drugs and their mechanism of action, their dose, and how they are going to show its action as a anti-asthmatic drug. And in the upcoming classes I am going to explain about the other classification of drug that I've already told you in previous class in one line, like leukotrienes inhibitors, mast cell stabilizer, then glucocorticoids, anti-IgE drugs, etc. into the upcoming class. So before going to the next video or today's video, please go and check about the simple classification and the intro of asthma. Thank you.